Time for Wednesdays with Wagle. Dr. Jason Wagle with Kansas Perio and Dental Implants. Good morning, Dr. Wagle. You know, when it comes to our teeth, I hear terms like plaque, tartar, and calculus, and I know they're bad, but can you help us keep these terms straight?
Sure. Let's start with plaque. Plaque is the sticky, colorless film that constantly forms on teeth. Bacteria live in the plaque, and if the plaque builds up, the body has an inflammatory response to the bacteria. The result at first is mild gum disease or gingivitis, and without treatment, the condition can advance to what we call periodontitis, which can lead to the loss of the gum tissue or the bone tissue and potentially the teeth.
So if plaque is this colorless film that breeds nasty bacteria, what about tartar and calculus?
Okay, tartar and dental calculus are two terms for the same thing. Whichever term you use, it refers to the plaque that has hardened either above or below the gum line.
So how do we get rid of plaque and tartar?
You can control the plaque at home by brushing twice a day and flossing once a day. You can also use a water pick and an antimicrobial mouthwash.
And what about tartar then?
Okay, tartar can only be effectively removed in a dental office. Dentists and dental hygienists have the instruments and know-how to remove the tartar.
And what happens if the tartar is not removed?
Okay, great question. The rough, hard surface of tartar is the perfect environment for more plaque to form, which means more bacteria and more tartar, and the situation just gets worse over time.
That sounds like a vicious cycle to me.
Yeah, exactly. You know, Steve, that's exactly what it is. And you have to break the cycle.
So your message is that to avoid more complex dental problems, you have to use those twice yearly visits, right?
Yes, correct. At Kansas Perio, we tell our patients the best way to minimize dental treatment is to maximize prevention by doing a consistent job at home and seeing your dentist at least twice a year. And if you have a history of periodontal disease or produce tartar more quickly, you may need to be seen more frequently.
All right. Thank you, Dr. Wagle. Wednesdays with Dr. Jason Wagle. It's sponsored by Kansas Perio and Dental Implants. And when it's time to get serious about your smile, go to kansasperio.com. Their phone number, 685-2731. 812.